Christian, Angela Murphy. I like it's kind of neat because I see people's names now. Hello again. So thanks for coming over here. Again, I am trying to get this, and it's different now because it's landscape. Somebody told me that the last time I did a live here, which was the only time I've ever done a live, that I shouldn't do it with unless I turn it the phone. So I guess this is the new angle we're going to use over here. Thanks for coming over here. I got an interesting thing to show you though. Oh wait, now we've got a question. I was going to show you something interesting, but now I got to ask this question. My grandfather died in the ER. So live chat. Sorry, I'm trying to find the message. Where is the message? I can't find the message now. Let's scroll. Let's scroll back. Oh, there it is. Okay. Grandfather died in the ER after they gave him medicine. Would this be a cause for a pathologist to do an external exam? He had a heart attack in the ER. So if it is a documented heart attack, and it is documented by, let's say, cardiac enzymes, so troponin, CKMB, we've got an EKG that shows ST elevation, things like that. That would not necessarily need to be a case. Sometimes families will ask for cases in that sense because they want to know. But when you have the diagnosis, you don't need to do the case. Sudden and unexpected deaths, sometimes those will be automatically referred, but that's it. So thank you everybody coming in from TikTok. I see you're all coming in and I really appreciate it. But no, to answer your question, Sarah, I don't think that that case, I would not request that case to be done. I have people come in and say, we had this heart attack, come into the ER overnight. And I say, well, was it a documented heart attack? And, if it's documented, there's no need to do it. And so they gave him dextrose and then he went, he was probably already in a rhythmic failure, basically. Now, let me show you what I was going to show you. Okay, I found this picture when I was at home the other day with my parents. This is me. Can you believe that? Look at these. I want to recreate this photo. I mean, that's basically what I want to do is I want to recreate this photo with, the updated, can I get some plaid pants like that? The bowl cut was definitely like I rocked that bowl cut for quite a long time. So just have a look at that. Look how happy I am. I'm probably looking at a renal tumor or something off the edge of the camera space there. I'm probably looking at a idiopathic pulmonary fibrosis or something. But anyway, yes, I had the bowl cut for many years. It was probably, how many years was that? So you've asked a question and I know that I don't have moderators over here, but I have mentioned, and I'll explain it here since people are just starting to come to my YouTube channel. I do not answer personal questions about my personal life because as long as I am in this job, it is dangerous for me because I am an expert witness and there are some people that I have to testify against that, not against, I don't testify against anyone. I testify and there are people who are maybe, they've committed crimes and I do not say anything that indicates my precise location or anything about my family. Although, I've talked about my mom and dad because, my mom will watch a lot of my lives. So, in fact, I suspect she probably watched the one over there, but she doesn't have YouTube, so she's not watching this one. like I said, they live kind of out in the country. There's not much to do. And so when my lives come on, I think that little bell goes off and then they watch. And it's funny because my mom will text me after a live and she'll go, "Oh, I didn't know that about you. Why didn't you ever tell me about that?" So, I have to watch what I say, obviously. I can't say anything too incriminating. Yeah, I will give her. Pathology is interesting. We only had very embalmed cadavers. Yeah, exactly. Um, uh, and I will say that that was my first cadaver was an embalmed cadaver. They had been embalmed for like 6 months or something. It's not quite the same as the anatomy. And yes, I do talk favorably about my parents because they they definitely supported whatever I wanted to do. Like it didn't matter if I could have said I wanted to be an archaeologist, or I could have said I wanted to be an artist, and they would have been okay with it. They would have absolutely said go for it. But of course, they were excited when I said I wanted to become a doctor. They were very supportive and excited, and they are not physicians. Um, so I was kind of the first person in my family to kind of go for advanced education. So yeah, and I don't get to see them very often because I don't live real close to them. So because I don't see them often, when I do things like lives, like that's how they see me because I hardly ever see them. Um, Let me scroll back here. Can you see effects from depression and anxiety on the brain? No, I cannot see physical effects with the brain. Um, Pathology is interesting. Okay, we got that one. Yeah, I'll give mom a shout out next time. It's funny because I'm thinking about going to visit them here in a few weeks, and I thought about maybe getting her to come on one of my lives, and she will be freaking out. Can I give a quick telling of your first couple of years as a pathologist? How did it go after all the schooling? So yeah, that's an interesting question. I finished residency and then I got a job as what it was a position called a junior fellowship. And so what that means is they give me all the difficult cases, and I had stacks of slides that I had to go over. Just it was the hardest work. I would get there at 6 and I wouldn't leave till 7 or 8 p.m. looking at slides and cancers and things like that all day. It was a great job, but it was indentured servitude type thing. So I got a job as a hospital pathologist in a small county hospital in southern Indiana, which is kind of what I wanted to do to begin with. I like the idea of being that small county hospital type person. And so I got that job, and I would say that it is not for someone who is not confident in their work. I was extremely confident in my diagnostic abilities, so I didn't panic when I got my first tray of slides and I started signing out, and something I get wrong here could result in me being sued. I did not get scared about that. I felt very confident in my abilities. And so I worked hard for a couple of years, 2 or 3 years in that hospital, to where I wanted to make sure everything was perfect and the lab was running well and everybody was happy and the surgeons liked me and stuff. And so, yeah, it went really well. I would say that it wasn't too tough because when you're in a smaller hospital, most of what you're seeing is stuff like appendix, gallbladder, lymph node biopsy, colon polyps, skin biopsies. And when you're in a smaller hospital like that and you're working by yourself, if you don't understand something, if you see something you're like, this is past my abilities, for instance, complex dermatopathology, then you just send it to Mayo Clinic, you send it to an expert. So I think that it worked out pretty well. I enjoyed it. I enjoyed working in a small county hospital. But eventually I decided to switch and become a forensic pathologist, and the rest is history. That's what I've been doing for 8 years now. So baptism of by fire. I actually do agree that that is the best way to get confidence. Um, However, in today's world, it's also extremely dangerous because now you can get sued for anything. So back, 30 years ago, 40, 50 years ago, I mean, you could make mistakes and you wouldn't get sued. Today, you can't make mistakes. And that's one of the hardest things about pathology is you really can't make mistakes. I mean, you have to do almost perfectly or somebody's gonna get sick. So yeah, it's a little rough. Um, Let me go back here. Was there anything different that you noticed that occurred in every COVID body? Um, so, a common indicator of presence. Yeah, no, I know what you're saying. You're basically saying what is like a hallmark thing that I saw. So, with the COVID pneumonia, what you see is something called diffuse alveolar damage, which basically the lungs are composed of air sacs called alveoli. And what happens is the lining of those air sacs become destroyed. And so when those become destroyed, you have inflammation, you have a lot of fluid rushing in, and that's pulmonary edema. And then basically the lining of the alveoli slough off into the airspace. Well, why is that an issue? Because you can't take in oxygen if that's the case. So you die of hypoxia basically in that case. Now, what's the second thing? The other is that you have somebody get COVID and they have a non-lethal COVID. They don't have to go to the ICU. They have a pretty bad case of it, but they're at home. They get back to their normal life, and then 4 to 6 or 4 to 8 weeks later, then they have a pulmonary embolism, and they die of that. So those are the two main things that I saw, and I've had those recently too. Do I ever get scared when you're doing an autopsy alone? Well, I don't do autopsies alone very often because I usually need to have an assistant, but I don't get scared. It's just kind of the autopsy, the person is no longer a person, it's a body. So you're not really that, I'm not that concerned or scared. It's almost more like it's an inanimate object because the job I have is to diagnose. And so I'm just trying to think about that as an anatomical diagnosis type thing. So let's scroll back here. Christian, the medical examiner's office is like close to your house. Been curious. Do you think they would let me in? Here's the thing with that. They usually don't let general public in unless they have a reason to be there. So in other words, we're talking like if you're a healthcare provider, if you're like an EMT, if you're a nurse and you want to learn more about it, they will sometimes let you in. But if you're just someone curious from the community, it's really hard to get in to see one. So yeah, saddle PE, EA says, yes, we saw lots of saddle PE. I have still see it. But the absolute apex of saddle PE was October, November 2020, and then like probably February, March 2021, massive amounts of pulmonary edema, pulmonary emboli. So Gretchen says, had it twice, and your long hauler. I'm sorry to hear that. I'm glad your lungs weren't affected. A lot of people are having cardiac effects, so high heart rates and things like that. Unsettled, I mean, I think unsettled earlier in my career, when you don't really understand the nature of what you're doing, it is a little unsettling. Yeah, I would agree. Do I use Dieners? So Diener it is in some ways an outdated term. I don't really use that term, but autopsy assistant, sure. Yeah, I use one for every case essentially. So Jennifer Francis has a great question. Have I ever diagnosed arterial spasms during an autopsy? Can it be seen? So this is really a great question because I have a demonstration I'm doing for coronary artery spasm. I was going to do it in February, and I didn't get a chance to put it together for February that I was going to do this demonstration, but I have the materials for it as a physical demonstration. and I'm hoping to do that soon. Now, to answer your question, no, because what happens with an arterial spasm is you have, the tube, the coronary artery, and then for whatever reason, it'll constrict like that. And it is a muscular constriction. So if that causes death, after death, then it relaxes and I can't see the constriction. So yeah, Christian says lots of sinus infections. Yeah, we're seeing that a lot where I am. Do I know much about alopecia areata universalis? I actually don't. That is a dermatopathologic diagnosis. I mean, I have a DermPath book sitting right next to me, but that is a diagnosis that is made by a special pathologist called a dermatopathologist. So I know the very basics of it, but not enough to speak like an expert on that particular thing. Let's see what else we got here. So no, arterial spasms are very interesting. They can happen for no reason, but they can also happen with cocaine use. That is probably the most common reason why a coronary artery spasm happens is cocaine use. So hopefully nobody watching the live tonight on cocaine, but that is usually what it is. What other things do we have to talk about tonight? Yeah, CTE. So CTE, chronic traumatic encephalopathy, which is typically associated with people who've had multiple repeated severe concussions to the head, commonly for football players, can also be seen in other contact sports, things like soccer where they use their head a lot, things like that. I have not personally made that diagnosis of CTE. What I do is I have been asked to take brains out of people, and I've had NFL players that I've had, for whatever reason, I've autopsied multiple ex-NFL players, and the family always wants to know about CTE. So I extract the brain, and then I send it to an expert in CTE who's over in Boston. And in fact, I am sending her a case. It's either tomorrow or Monday. We're sending her a possible CTE case. But it's not a diagnosis that I make. Usually, we let the neuropathologist make that diagnosis. Now, somebody was asking about fentanyl. Fentanyl is so common that, it has to approach the most common cause of death that I see. And the most common is going to be atherosclerotic cardiovascular disease, but fentanyl is by far the most common kind of like opioid drug, right, that we see killing people. It used to be, when I first started, hydrocodone and oxycodone, people who were crushing them up and snorting them, or even injecting them. That was like 2015. We used to see tons of that. We would see plain old heroin, which is actually, the chemical for heroin is diacetylmorphine, okay? And then what happens is it breaks down into monoacetylmorphine, and then it's basically just creating morphine, okay? So now I haven't seen heroin in anybody's blood for probably 6 to 8 months, but fentanyl is there on all of my opioid overdoses. Hardly ever see hydrocodone, hardly ever see oxy, hardly ever see heroin, never see morphine, but it's just fentanyl now. All right. Multiple TBI, we had a car accident, Harvard Brain Bank. I mean, I think that's the person I actually send to. Yeah, but I don't usually make those diagnoses. What I see is at the time of autopsy, sometimes we'll have a report that this person has had multiple traumatic brain injuries. And I will take the brain out and I see these gelatinous kind of tan brown areas in the brain, and those are healed contusions of the brain, which are basically concussions, When the brain is concussed hard enough, you'll actually get bleeding. And so repeatedly this occurs, and it's quite dramatic. I had a case semi-recently which was so dramatic, and I took pictures, and I'm gonna show it eventually. I usually just like a fair amount of time to pass between when I do the case and when I show the case. But it's probably the best case of healed old concussions that I have ever seen. And so I will be showing that here, and I'll be showing it at Instagram, and I'll be showing it at TikTok if TikTok, exists or whatever. So let's see. Thank you, April. I appreciate that. Can carotid arterial disease be reversed? So carotid arterial disease refers to atherosclerosis within the carotid arteries. Pretty common as people get older. People get these arteries that are basically crunchy because they have so much plaque and they're calcified. So there's two things. Usually your doctor will put you on a statin to decrease that amount of plaque in the artery. So statins supposedly help. But the other thing they can do is they can do a carotid endarterectomy where they actually take the plaque, they go in and they just clear it out. That'd be number two. Number three is I think they can put stents in there. So yeah, let's go back here and see how many people have asked questions that I missed. Have I ever seen Fournier's gangrene? I have not, and yes, that sounds terrible. That's obviously a condition with the penis, which causes a lot of deformation. I have not seen that, and it just hurts for me to think about it. So, Sarah, I'll answer your question in just a minute. Violet says, have you autopsied persons who had any damage from long-term ibuprofen use? So I would say no. I have not autopsied somebody that I could specifically say you have ibuprofen damage to your kidneys. Usually the people who are on chronic medication like that, they usually have some other kind of reason for why that is. And sometimes you'll see the pathology for that reason. But I haven't seen, like, kidney damage is the classic thing for that, where I've looked at the kidneys and said, this is clearly ibuprofen use, but chronic use can cause us problems. Number two is ulcers. Okay, so if you take enough nonsteroidal anti-inflammatories, you end up with ulcers. And I have seen people die of ruptured ulcers, but I cannot say that they occurred as a result of ibuprofen or whatever. And then somebody, I think Sarah, asked about the COVID vaccine. And it is a controversial question, right? Because no matter what I say, it will be twisted or it will be mutated. People will disagree with me. I don't personally make recommendations for people to do, like, hey, you need to do it or you're a bad person. The question that comes up is, have I seen it harm people that have caused death? Because harm not causing death is one thing, and harm causing death is another. I only see death, and I have not seen it where it has caused death. So I guess you'll just have to make your own decision on that. Alyssa says, have you ever seen prion disease? And I have not, at least purposely, seen prion disease. If I think it could be a prion disease like Creutzfeldt-Jakob, and I am concerned that it could be clinically that, then I will pass that on to a facility who can take care of that. The med center is really the only place that'll do those cases. I will not do those cases in the places where I work because I do not have the ventilation. I do not have the suits and the special equipment to do those cases. Okay. Beloved cousin played semi-pro football, developed psych issues in his 20s. Alzheimer's-like issues, then died of COVID pneumonia. Yeah, that sounds bad. It's really sad, people who develop the psych issues. And why do they develop psych issues? Well, because a lot of those concussions that they have are actually in the frontal lobe, and the frontal lobe is what controls our personality. Not totally, but for the most part. And so if you damage those areas, you have personality changes. And that's why a lot of them do have personality changes, anger issues, and things like that. Donating your organs when you die. MRI showed hemosiderin. Yep, iron staining. So, well, hemosiderin is okay. So basically, let's think about this. If you bleed as a result of concussion or traumatic brain injury, red blood cells are going into the extravascular space, meaning outside the vessels. At that point, your body has to clean that up. When your body cleans that up, the hemoglobin gets broken down. Hemoglobin gets broken down into the iron-containing component, which becomes hemosiderin. And when I look at that under the microscope, I can see macrophages that look brown. That's the hemosiderin. Another book, yeah, in all my spare time. Actually, yes, I was just talking about this today. It was great. It was actually really interesting because a police officer who I think I've met him once before. He came to one of my cases and he said, by the way, I bought your book and can you come and sign it? If I bring it in, will you sign my book? And I said, of course I'll sign your book. And then I was talking to him about how I am planning to write another book. I just have to carve the time out. And so we'll see if I can do that. So Jennifer says, arterial spasms. You have arterial spasms and you've had heart attacks due to them. That is, I would be interested to know if that is spontaneous or is it due to, some other underlying issue. Send brain for CTE and they wouldn't do it. Well, that's a little, unfortunate, isn't it? Usually if families ask me to send for for brain for CTE, I will do it for them. I will do the extraction of the brain, and we have to be very careful and we have to do it quickly. So Shanisha Clark says, finally got to join one of your lives. I'm glad you're here. Unfortunately, I am leaving in a few minutes, but you'll be able to watch the replay for this because it'll save to my YouTube page and you can watch it. But I'm going to start doing more lives here. I started in TikTok tonight, got a few people to come over and come here. And we have more than we did last time, probably 3 to 4 times as many as we did last time. So that's great. So Spacey, it's possible I could sign it. The way that we could do that is if you buy it through Amazon, you could technically mail it to me and I could sign it or write something in it. The other way is that you can buy it directly from me. I have a stack in these bookshelves of about 60, and you can email me and it costs a little bit more because I have to pay for postage. Yeah, so you don't use recreational, and I wasn't implying that, by the way. I'm just saying if you read the textbooks, the most common is cocaine, but I know they happen spontaneously. I'm glad you're enjoying the live replay. You're going to start seeing a lot more of these at this account. Have I ever had twins? Like personally, I have not birthed twins, so no. But if you're asking about have I had that at Autopsy, I think there was, I did once. It was, they were fetuses that were intrauterine fetal demise. But yeah, so let's see. Do I utilize PAs? Yeah, we do have PAs. I think I had a clinical PA rotation once. I've had other PAs that are on clinicals like in the ER, and they'll come to my cases sometimes. So that's fun. And I've had people that have done internships in the offices where I've worked who have went on to become pathologist assistants. And in fact, one of them is basically my backup assistant. I haven't had to use her yet for that, but I have 2 assistants that come to most of my cases. And if they can't, then I'm going to call her. Have I noticed an increase in incidence in CAD in relevance to diets with more processed food? Well, the thing is, we've been eating processed foods for 40 or 50 years, and I see lots of CAD. I can't link it specifically, but I would have to think that it's related, high sugar content and stuff. So yeah, well, I mean, we see so much CAD, you don't even know where to start or finish. I don't know how you can stand seeing brutal trauma postmortem. Yeah, I mean, it is definitely a mindset that if you can't get in that mindset, you can't do this job. And I'm not trying to be exclusive or elitist or something. It's just people who are in this job have the ability to not be bothered by that. Now, do I sometimes see trauma that's so horrific it almost causes me to just have to take a moment? Yeah, I do occasionally see that. I had a case in the fall that was a murder case, and it was I would say it was the most vicious manner of the way that it was conducted that I've ever seen. And I mean, like, it was the kind of thing when the body bag opens, my jaw almost dropped. I was like, I can't even believe what I'm seeing. It was so unbelievably vicious. And someday I'll talk about that case, but I can't talk about any case that hasn't gone to trial, and that case will go to trial at some point. But yeah, occasionally, I mean, once every 4 or 5 months, I'll see something that just will cause me to almost have to take a deep breath and reset. Let's see here. Let's do a few more minutes here because, we have some new people come in. And I'm happy to see 46 here right now. I think we were over 50 a few minutes ago. This will be good. This will be, I think, a good place for us to do this. And hopefully I can do these to where, like I said, I'll do the podcast here. I can do some demonstrations. Tonight I'm just talking. But, I'm hoping to do drawings and things like that to show you guys. So what do I do to decompress? So one fortunate thing about my job is that I actually don't live really close to where I work. And I'm able to have like a nice drive, after I finish some crazy cases. I've got a nice long drive to decompress. But when I get home, I mean, I do all sorts of things. I do yard work. I draw, I write, I do all sorts of things. I ride my bike and stuff like that. I live near a river, so I go walk by the river and stuff like that. And then I do silly things like I'm dead serious, I collect Garbage Pail Kids. You remember those from the 80s? Well, they've got newer ones now. So I collect those, and it's basically like a black market. It's basically like a cartel, and I'm caught up in it. So if anybody wants to send me those, I'll gladly take them. Let me flip back here because I got a bunch of questions. What am I watching right now? So I am watching Breaking Bad right now. I am midway through season 4, and I am absolutely enthralled by it. It may be the best television show of all time. Christian says, will YouTube be my preference? I don't think so. Okay, it will be my preference because I'm going to do the podcast here, but I'm still going to do TikTok lives because TikTok videos for me it's just not working out very well because they limit me so much in what I can do that I'm more likely to do less videos but more lives. And let's scroll back here. Is there a way to get notifications? So Phyllis says, is there a way to get notifications? Somebody can correct her or correct me if you want, but I believe if you go to my page, there's a little bell and you click on the bell, and I think that will notify you if I'm doing a live or a video comes up. So people can tell her if I'm wrong about that. I'm still learning. Amy says, I love your platforms, whether live, audio, or video. If you ever decide to run formal classes on a platform, I would most definitely sign up. So, Amy, that is something I am considering because I obviously know a lot about medicine and forensics. I teach police, I teach coroners, and then I teach one-on-one with any students who come with me. I teach medical students as well. So, yeah, if I can ever find an outlet for me to teach classes online, I'll absolutely do it. So email me if you think of anything for that. So, yeah, so, wait, I'm way behind. So pet my cat. My cat's not around. He's asleep, I think. Music, I'm all over the place with music. I like everything from old, like 1970s country to like speed death metal. And even some rap too. Do I like Star Wars? I do like Star Wars, but I haven't watched Andor. I got behind on my TV watching. I heard Andor's really good, but I have not. I have not seen it. I am going to watch it though. Yeah, I should find a platform. If you um have an idea of where I can teach online that's not just YouTube or whatever, like people pay for the lectures or whatever, I'll do it. I don't think I'm quite big enough to do a master class, but who knows. So you still have all your GPK stickers from when you were little. Well, if you've got series 1 or 2, I can definitely purchase those off of you. Uh, yeah. So yeah, Zoom. Oh, I see what you're saying, Christian. You're saying that I would do a Zoom like class or something like that. So if you have more information, see, I don't know anything about this stuff. I'm new. I'm not a spring chicken to being on social media, but when it comes to this sort of stuff, this is where something like a social media manager would be great because I don't know any of this stuff, and I could probably do a lot better than I'm doing. So worked in forensics in Juarez. Do you have carboxyhemoglobin for carbon monoxide poisoning? And how do you make diagnosis of sudden infant death? So yeah, carboxyhemoglobin saturation is how we do CO. We just draw a tube of blood into a gray top tube, send that to the tox company, order carbon monoxide or carboxyhemoglobin saturation, and there you go. That's how you do it. SIDS is diagnosed. First of all, I don't use the term SIDS. It's sudden unexplained death of an infant. How do I diagnose that? One is no evidence of foul play, no evidence of natural disease, no evidence of toxicology problems, so a baby accidentally ingests something, and no evidence of microscopic disease. So you have to look under the microscope at all the tissues. And finally, and this is one that not everyone does, but genetic studies. So negative for all that equals SIDS. So Arturo, good. Thank you so much for that. You would subscribe for online lectures. So Arturo, let me find out more from my genius moderators who know way more about this than I do. Maybe they can give me some suggestions because I would love to give lectures. I mean, I think it would be a lot more efficient than doing lives because I'm all over the place on lives. But I could say, hey, today we're going to talk about unexplained pediatric deaths, or we're going to talk about, gunshot wounds, or we're going to talk about forensic neuropathology, all of this stuff here. So yeah, I might be able to do that. All right, let's go back to Shannon. I'm a medic, found my mom dead. I'm sorry to hear that. She had a heart attack or a stroke. I declined an autopsy because I am adopted. So you're basically saying that you declined an autopsy because whatever they found genetically wouldn't apply to you because you're adopted. Well, I mean, not everybody necessarily needs an autopsy. I don't advocate strongly for everyone to get it. I only advocate if the diagnosis isn't known and the family's going to suffer. See, the ultimate thing that physicians must do, not just physicians, but any healthcare worker, is we have to minimize suffering, okay? We have to minimize suffering of the patient and the patient's families. So how do we do that in pathology? I minimize suffering with information, okay? The information that I get from an autopsy may minimize the psychological suffering of the family because then they know what happened. Because sometimes not knowing is actually a form of suffering. So that would be number one. And number two, autopsy can deliver justice. So the other way that we minimize suffering is by delivering justice. So, not everybody needs an autopsy or wants that, but, that's your decision if it's not a legal case. So Angela says, if anybody wants to follow, click on the bell. So click on the bell and follow me. I would like to get to 10,000 followers on here. Well, actually, I'd like to get to 1 million followers on here, but I've been short of 10,000 for a little while, and I just started ramping up my YouTube again. I did that because TikTok is being so weird. I can't deal with them, so I'm going to start hanging out over here. Okay, so let me scroll back here. Arturo says, what forensic pathology books would make it to your top 5? So this DeMaio gunshot wound book, DeMaio, that's going to be in there. I would say that there is a book called if you type in Dolinak, I think it's called like Principles of Forensic Pathology. I think that's actually the best book in my opinion. There's another one called Knight. That's good. Knight. People like that one. Catanese is the author of short book, but pretty good. And I would say just because most people have it, Spitz and Fisher, it's this blue and black book here. It's out of date. There's no question about it, but everybody has that book on their shelf because it's written by like the biggest names in forensic pathology. If they ever do an updated version of that book, that's going to be the absolute #1 book to get. All right, let's check out what else has been said to me here, so I can scroll back. Working in OB when we have a stillbirth, is it better for the parents to leave the autopsy go because it usually seems nothing is usually found unless it's obvious? So let me say that I do all stillbirth autopsies in the counties where I work. Any stillbirth is given to me through the hospital systems and through the county. I do agree that very often we don't find an answer because those answers are not due to the fetus, they are due to maternal factors. So pathology in the placenta, pathology in the mother is having a eclampsia or something and the baby dies. And sometimes we just have no idea why it happened. You can't find a cause in the mother, a cause in the placenta, or a cause in the fetus. However, in the cases where you can, it is a great relief to the family. You can also get material for genetics if they have serial stillbirths. That's important to know. So I would say that I personally do not love doing stillbirth cases because they are usually macerated and decomposing by the time I get them. They're not very high yield. But this year, probably in the last 6 months or so, I've given a very definitive answer to at least 3 of those parents. The other thing is it does in some ways help them understand that it was nothing that they did. So that's why that autopsy can be helpful. So, yep, Robbins is sitting here. I got a couple Robbins sitting there. And I read through that book when I was in medical school. Did I ever get Andreas Vesalius's book? I have not gotten that one, but of course that is an epic work with a lot of great drawings in it too. All right, kids, we're gonna go a couple more minutes and then I'm gonna have to cut it out because it's 10:08 and I'm excited. I think we've done a pretty good live over here, and I'm learning a little bit more about this whole process because if you just ask me to talk about forensics, it's very easy for me to do. I do not need to refer to anything. It's all up here. So that's easy. The hard part is figuring out how to get everybody on the same page and, making sure that my content is decent, decently put together. So let me scroll back here. What podcasts do I listen to? I don't actually listen to any podcasts. I'm kind of a weird person in that I don't really watch anybody else's TikToks. I don't really listen to any podcasts or anything. So that makes me sound not very interesting. But the problem is I simply don't have time to do anything except my own stuff and my job. So I'm hoping that maybe my life will turn around a little bit better and I'll have more time to do that sort of stuff. Thank you, Twinkin 2. Online lectures would be awesome. You are well-spoken. You make information easy to understand. So yeah, I mean, I'm going to look into this online lecture thing, and maybe we can do it. Maybe like once a month, we can do a topic in forensics or medicine. Do I have dogs? I do not have dogs. New findings in SIDS deaths. They reported I think it was a butyresterase enzyme thing, and they said it was the absolute cause for SIDS. But some of the, I guess, review of that work indicated that maybe it wasn't as definitive as we thought. And so we don't have a test for that. We don't send out for that. Long drives, I can listen. Yeah, I mean, you're right. I usually just listen to music, though. I think it's I can't even remember the last podcast I listened to. Am I writing reports tonight? I was going to, but I just, at this point, I don't think so. I've got a case review I have to do. That's different from a report. It's like I actually have to review a previous case, and I've got some trials to go for. But at this point, it's 10:15 my time. I'm probably just going to chill out or something. Can you just be a forensic pathologist versus what? I mean, I am a forensic pathologist, and I don't know what you mean by that. Can you just be a forensic pathologist? Oh, without certifying as a pathologist? No, you have to get certification as a pathologist, because the reason why is that we have to understand all of disease. So when we have a case, we have a person who's passed away, we have to review all of their medical records. And in order to understand those medical records and all the diseases within them, you have to be a pathologist. So first a pathologist, then a forensic. And that's what I did. I became a pathologist, worked in a hospital for 6 years, and then I went to forensic. So can you only get certified for criminal work and not hospitals? Yeah, I mean, if you work in no, you can't get certified just for criminal work, but you don't have to work in hospitals either. If you get certified as a forensic, you go work at a medical examiner's office and never do a hospital case ever again. Never look at the microscope, although I tend to. You can see my microscopes right here. So, and that's because I love all forms of pathology. Got slides sitting all over my desk. Anyway, so I think that's probably going to be it for tonight. I have went on a little bit longer, but I do appreciate everyone that came over here from TikTok and anybody who came in not at TikTok. And we'll talk more about lectures, and we'll try to do at least a couple of lives per week in addition to the podcast. And yeah, so thanks again for coming over. And I will do more microscope stuff, Christian. I see your comment there. And but yeah, thanks for everyone. And again, never forget this outfit. I'm telling you, those pants, this is what I'm talking about. Little giraffe on the shirt there. Maybe it's a dinosaur. I don't know. All right then. Thanks a lot.